When we talk about hepatitis B prevention, then we are basically talking about what? Hepatitis B vaccination. Thankfully, we have a very great vaccines available that offers a high seroconversion rate of about 95%. This tells you that these vaccines are very good. And when you take them rightly, they'll give you that level of protection. So that's the primary prevention. The other prevention has to do with practicing safe sexual, intercourse, use of barriers like condoms. Also, we mentioned sharing of sharps. So in this case, you avoid sharing sharps. The other time we mentioned about some guys going around using one common instrument, trimming fingernails of everybody and taking money. We call them abochi. This practice has to stop. These are some of the preventive measures. And mothers who give birth to hepatitis B, mothers who are hepatitis B positive, we need to take some vaccinations. So the Hep B vaccine, one will ask, how is it taken? So we usually have three. The routine one we have has with 3 doses. There are some Hep B vaccines which are combined with hepatitis A vaccine. They are not really common in our setting. And so it should be given 3 times within 6 months. That's the routine one. We have other schedules we call rapid schedule. Rapid schedule means taking it consecutively for 3 months. But with that, you need a 4th dose at 12 months. People take the 3 months without taking the 4th one at 12 months. But I've always argued that why don't you take the 6 month, which will be cost effective because you're not going to pay extra for the 4th month if you are taking 3 consecutive. So this is it. When you take the Hep B vaccine, it's expected to offer protection. But the vaccine manufacturers, they are quoting over 20 years, 30 years, and the likes. There's a myth that the vaccine expires in 10 years' time, and after 10 years, people are saying, I want the booster, my vaccine has expired, and all that. You really don't need a booster if you've produced antibodies. I always encourage people to check their hepatitis B antibodies titer levels. Just as I did, I had more antibodies even after 10 years of vaccination. In this case, there was no need to go ahead and take anything called booster or start all over. Even with the antibodies titer level, it's appropriate to check it 2 months after your last injection. So the 6-month schedule is projected on the screen. You take it. So for instance, January to June, when you take January, the next dose will be in February, and the last dose will be in June. This is how it is done. This is how it's calculated. If you take it consecutively for 3 months, January, February, March, remember to take a 4th one at December, like the 12th month. This is how it is done. This is the appropriate, this is the best way to ensure that you produce the required antibodies to fight hepatitis B infection. And when you are done with the vaccination, check your antibodies titer level, like I have done, to be sure that you really produce antibodies. We've come across people through our activities who took the vaccine series and have tested positive. They are shocked. Probably if they had checked the antibodies level, they would have known early that the vaccine didn't work based on multiple factors. They would have taken the earliest intervention, but they were waiting for 10 years, and at 10 years, they were infected. So we encourage you to check your antibodies titer level after your vaccination to be sure that you are fully protected.